The United Kingdom is testing a COVID-19 contact tracing app on the Isle of Wight. The app, which was developed by NHSX, the digital technology unit of the National Health Service, will keep a record of whom the user comes into contact with. It will upload this information to a central database to help public health experts study the behavior of the virus. If the user becomes ill, the app will send a notification to everyone they have been in contact with to self-isolate. According to the British government, the NHS COVID-19 app will use Bluetooth low-energy handshakes to exchange identifiers, which are essentially random strings of numbers with other devices to register proximity events. If a user has symptoms or tests positive for COVID-19, they enter the result into the app. The app then prompts them to upload the previous 28 days of Bluetooth identifiers to a central database. Epidemiologists say 60% of the population must use the app for it to be effective. The health service will use an algorithm to determine which devices need to be notified. Devices will periodically download the identifiers of everyone in their region who has reported symptoms or tested positive. The system will detect a match if it is someone they encountered and alert them. The Isle of Wight is a small island in the English Channel with a population of around 140,000 people. Announcing the move on May 5th, Health Secretary Matt Hancock said the isle's size is ideal to conduct testing under scientifically controlled conditions. The NHS COVID-19 app will be rolled out for the rest of the nation by the end of the month. Privacy and trust questions have been raised as data will be initially stored on the user's device. It will be uploaded to a centralized database if the user reports symptoms. This will give the government a record of the user's recent social interactions. The data cannot be deleted, and the NHSX says it will be used for research purposes related to public health. Privacy advocates also fear mission creep if the program is expanded or continued for the purposes after the pandemic has ended. The NHSX has said it will publish the code for the app, which would allay some privacy and security concerns. Another question is if enough people will download the app for the program to be effective. A similar app in Singapore was downloaded by only 20% of the population. According to Singapore's The Straits Times, COVID-19 has an infection number between 2 and 3 globally, meaning each patient infects 2 or 3 more people. Citing a public health expert, the newspaper reports the infection number in the city-state has dropped to 1 since the government-ordered lockdown started on April 8th. According to Alex Cook, Associate Professor of Public Health at the National University of Singapore, epidemics have biological and social factors. By limiting exposure to carriers, social distancing could slow the spread of COVID-19, even if the biological factors remain hard to tackle. According to a study published by the Centers for Disease Control and Prevention, COVID-19 has been difficult to contain partly because asymptomatic carriers are already infectious. Writing in a report, the National Academies of Science states previous reports suggest breathing could spread coronaviruses to a distance of 2 meters, as evidenced by viral RNA residues. Yet another study published in medRxiv suggests the virus that causes COVID-19 could survive on printing and tissue paper for less than 3 hours, but 2 days on wood and cloth, 4 days on glass and banknotes, and 7 days on plastics and stainless steel. Singapore has shuttered workplaces and closed public schools to let students study remotely as part of its policies designed to contain the epidemic dubbed circuit breaker measures. Cook was cited as saying Singapore's confirmed cases have risen to 1,481 as of April 7th. However, he claims most cases were imported, and Singapore should be able to control the disease if the nation shuts its borders. So kids, don't do this during an epidemic, or this for that matter. Meanwhile, Taiwan is working on a social distancing app that people can download on a voluntary basis to help prevent the spread of the coronavirus. The director of the country's Department of Cybersecurity said on April 11th. The Taiwanese social distancing app uses Bluetooth to keep track of when the user gets close to other people. Data will be encrypted and saved in the user's device and will not be collected to track the user's movements. The app will issue an alert each time the user gets too close to someone else. It will also provide data on how often the user came too close to others during each day. According to the Taiwanese government, the app's primary purpose is to provide users with information about crowded places so that they can avoid them. Social distancing guidelines from Taiwan's Central Epidemic Command Center advise people to stay at least 1 meter apart outdoors and 1.5 meters apart indoors. The social distancing app is being developed based on a directive issued in mid-March by Vice Premier Chen Chi-mai, according to Chen Hongwei, director of the Cybersecurity Department under the Executive Yuan. It is currently being tested and will be released within the next 2 weeks, Chen said. While the Taiwanese government is emphasizing the privacy-friendly nature of its social distancing app, Israel is taking a much more invasive approach. The New York Times reports Israel will monitor cell phones to track people with COVID-19 and those who have come into close contact with them. The government will comb through the geolocation data gathered from the country's telecommunications providers to pinpoint those affected. This will then be used to track the history of the infected person's movements and to identify potentially infected individuals. Once identified, those suspected of catching the virus will receive a message telling them to self-isolate immediately. For more news animations and explainers, hit the subscribe and bell button to join the TomoNews family. Thanks for watching.